My name is Tima Clinty. I'm an Executive Vice President with Healthcare Minnesota. And prior to becoming an officer with the union, I worked 15 years in the emergency room. So Dr. Foss, I appreciate hearing your story. And I'd just like to say quickly for my 30 seconds that I'd like to share that my son, who is my oldest son, 22 years old, was kicked off of my husband's health plan because I don't know how the insurance company found out so fast, but they said he was no longer a full-time student and was over the age of 18 and was out of the house. And I said, well, he needs health insurance because he was away playing football for a college. And they said that he would not be covered. And because of the Affordable Care Act and my knowledge of my 15 years working in the emergency room and seeing what happens to a lot of the patients that come into the emergency room, I wanted to educate myself on this bill. So I pushed back with the insurance company and gave them a little education about my son, who, yes, he is older, and no, he's not a full-time student, but under the Affordable Care Act, he should be covered. And I pushed back and I advocated strongly for my son, and I'm glad that I did because the insurance company said, well, we have time, we don't have to do it now because the law's not in effect. They gave us some leeway, and I said, no, he needs to be covered now. And I strongly advocated for him, and they put him back on the insurance plan, and I'm glad that I did push back because months later, he did break his wrist playing football, and he broke a blood supply bone and needed a bone graft from his hip to his wrist to continue to play football. If I had not pushed this, and because of President Obama's Affordable Care Act, my son would not have been covered and would have endured a high medical cost at a young age. A lot of us parents, we think about that when we send our kids off to school about their health and debt. So I would say to you all to push and advocate for your young people. That's my story.
My name is Mark Della. I work at Methodist Hospital in St. Louis Park and also a member of SEIU. My son is Andy Freeman, and he is an autistic young man who's 21 years of age and is currently enrolled at HCM, the Minneapolis Community Technical College. For the past year and a half, our insurance company has been attempting to kick Andy off the insurance, even though we have documentation that he is a full-time student. The insurance company kicked him off twice. Each time we reinstated him. Out-of-pocket expense each time was $683 that we had to pay to reinstate our son on the insurance. So it's $1,300 and some odd dollars later, and because of the Affordable Health Care Act, our son Andy is now covered again. And because he is handicapped mentally, I don't know if he will be able to find full-scale employment throughout his life. So this is a concern for me because without full employment, he may not get health care insurance benefits, and with our unemployment now that we are facing in our society, it needs to be addressed not only for the individuals who are handicapped, but also for each and every one of us. So that is my story, and thank you for fighting for this Health Care Act.
About 5 years ago, my wife was pregnant with our only child. She was admitted to the hospital at 22 weeks, 5 days of the pregnancy. She was told that if she did not make it to 23 weeks, they wouldn't even send a delivery team. She made it 4 more days, so they did. My son was born. She had to deliver because of a HELP syndrome. It's a form of preeclampsia. My son was born at about 620 grams. That's 20 ounces. I tell people it's about the size and weight of a Chipotle burrito. He was in the hospital for 151 days, and he's doing very well. He's almost 5 now. He has some conditions are still following. He has chronic lung disease, bronchopulmonary dysplasia. He had some retinopathy of prematurity, which makes his eyesight kind of bad. I've never looked at any of the bills since the 3-week mark. Then it was $330,000. The lifetime maximum for our health insurance is $2 million at the time he was born. I'm sure he's very close to that, if not well over by now. He's had 3 surgeries and is scheduled for 1 more. There's other things I'm very concerned about that the health care bill addresses. The first, of course, is the ban on His kidney condition they're following for would probably bar him from being covered if that hadn't passed. And the fact that my wife and I now can even think about becoming entrepreneurs, which wouldn't be possible if we were tied to our jobs. The last thing I wanted to say is that I'm an attorney. I do primarily bankruptcy work. It's very distressing to me how many people come to me for bankruptcies with a large amount of the reason they're coming there because of medical bills. I think it's a disgrace in our society that people have to go bankrupt because of medical bills. And if if my job is the one that gets killed by having this problem addressed, I'm fine with that.